This is where things go wrong by not taking this cut seriously and going to the doctors. Killer instinct, 10 out of 10. Health sense, 0. Hepatitis C, also known as HCV, Hepatitis C, is an enveloped positive strand RNA virus belonging to the Hepatitis genus within the Flaviviridae family of viruses. There are 6 main genotypes, with genotype 1 being the most common worldwide. Hepatitis C is a liver infection caused by the HCV virus that attacks the liver, which is the largest organ in the body, and leads to inflammation. HCV is the most common bloodborne virus that spreads through contact with blood that is infected with the virus. Transmission can happen through sharing needles, syringes, other drug injection equipment, sexual contact, and from mother to baby during pregnancy or at birth. In 2015, according to the Global Hepatitis Report, 71 million people were chronically infected with HCV, yet only 1 out of 5 were aware of their status. Every chronic hepatitis infection starts with an acute phase that usually goes undiagnosed because it rarely causes symptoms. About 75 to 85% of people get infected with long-term chronic hepatitis and usually have no symptoms for many years. Symptoms appear only after the virus damages the liver enough to start causing them. The symptoms may include things like bleeding and bruising easily, fatigue and weakness, loss of appetite and weight loss, jaundice, yellowing of the skin and yellowing of the eyes, dark-colored urine, itchy skin and hives, swelling in legs and joint pain, confusion, drowsiness and slurred speech, sleep disruption, and many more things. Serious complications can happen like cirrhosis of the liver, liver failure, liver cancer, and sometimes death.
Hello? What? Who are you?
This could have been avoided if you had went to the doctor.
That's right.
There is no vaccine for hepatitis C, but a healthcare professional will likely recommend vaccines against the hepatitis A and B viruses simply because they can cause liver damage and make hepatitis C worse. Antiviral medications are the treatment of choice for most people with ongoing chronic hepatitis C infection. These medications often can cure chronic hepatitis C after about 8 to 12 weeks. Acute hepatitis does not always become chronic, and some people clear the infection from their bodies after the acute phase. That is called spontaneous viral clearance. The goal of treatment is to have no hepatitis C found in the body for at least 12 weeks after treatment ends. In some cases, a liver transplant is necessary, but that does not cure hepatitis C. The infection is likely to return. This means more treatment with antiviral medications to prevent damage to the new liver.
Okay, we can keep this shot going, but then we're gonna have you do the cheesy line to the camera.
Yep. And remember, no matter what your job is, be careful around sharp objects.
There we go.